I'm very glad that Marilyn invited me to come up with different institutions and different organizations in our community. So it's very, very important that we utilize you folks as ambassadors to go back to your organizations and promote the importance of oral health. A whole list of things that I really want to talk to you folks about, but I'm going to try to focus really on kids, on children. So a long, long time ago, back in the day, kids used to go to the dentist only when they needed some sort of treatment. That is not the model that we're going to follow anymore. There's an organization called the American Association of Pediatric Dentists. They're in the forefront of trying to make policies and encourage our local cities and states and the nation overall to pay more attention towards oral health. And one of the things that they're really talking about right now is to develop something called a medical home and a dental home. So what is a dental home? A dental home is a place where kids can go to for their dental treatment. And what does that mean when you say it's a home? It means that they can go to this one dental practice that they're familiar with. They know the doctor, they know the front desk, and they're not afraid to go to it. Their first visit shouldn't be when they have their first traumatic event. You know, they fall in the soccer field, a ball hits them. The two front teeth, the central incisors, are the most common teeth to get injured during childhood. And very often that is the first time kids go see the dentist. The American Association of Pediatric Dentists wants to establish something called a dental home for children to go to. And for a lot of our kids around here, it may be the community health centers. Unfortunately, it may be the dental providers that come to their school. That's not really a dental home. That's sort of, because if you have a traumatic event or if you have an incident, you're not going to be able to see that provider because they're here to serve the school. So we're trying to develop something called a dental home. So that's one of the new concepts that's so important that we all understand. The second thing is, a fact that's so important for you guys to remember is the first dental visit for a kid should be at age between 6 months to 1 year. And why is that? It's pretty early, wouldn't you say? At 6 months, right? At 6 months, the two lower front central incisors, they start to erupt. So there are a couple of reasons why we want the kids to go see the dentist at age 6 months to a year. Number one, the dentist isn't going to do much because they wouldn't have any problems. So the kid would be used to this guy coming in with some funny glasses and a white coat. You bring them in at age 6 or age 3, they're scared. You want to develop, once again, the whole concept of a dental home.